Hello everyone, welcome to SCNM's webinar. We're very excited to bring you this interactive online experience that will let you learn more about the future of naturopathic medicine and the Affordable Care Act. My name is Eve Velotis and I will be your host for today's webinar. Before we begin, let me take a minute to familiarize you with the technology that we'll be using today in your control panel. You'll need this tool in order to actively participate in the webinar. First, make sure that your control panel is expanded. There should be a box like the one shown in the upper right-hand corner of your screen. If you do not see this box, look for a double arrow. Click these arrows and your box will expand. Second, make sure that you can see my desktop, which currently shows the image of the webinar control panel. This is the window that you'll use to view today's presentation. You'll also have the opportunity to ask questions. To do so, just type your questions into the box indicated here. Your questions will be answered verbally at the conclusion of the presentation. We anticipate today's webinar to run approximately 60 minutes, 40 minutes of presentation, followed by 20 minutes of question and answer. Before we begin, though, let me give you a brief introduction to naturopathic medicine. As many of you know, NDs concentrate on whole patient wellness, attempting to find the underlying cause of a patient's condition rather than focusing on symptomatic treatment. Naturopathic doctors use natural therapies rather than synthetic drugs. Naturopaths follow the 6 fundamental principles that you see on your screen. First, do no harm, the healing power of nature, find the cause, doctor is teacher, treat the whole person, and preventative medicine. Although our presentation today will focus more specifically on the Affordable Care Act and as it relates to naturopathic medicine, if you have specific questions about the medicine, time permitting, we'll be able to answer those as well. During this webinar, you'll be hearing from Dr. Paul Mittman, SCNM's president. Dr. Mittman's presidency at SCNM began in 1999. Throughout his tenure, the college has consistently improved the quality of its education and patient care, contributed new knowledge on naturopathic medicine through research, expanded its outreach to medically underserved communities, and established itself as an innovative, dynamic, and caring community of healers. Dr. Mittman sits on the boards of the Tempe Community Action Agency, Gift of Life Arizona, the Association of Accredited Naturopathic Medical Colleges, and the New York Association of Naturopathic Physicians. He earned his BA from the State University of New York at Buffalo, his Doctor of Naturopathic Medicine from National College of Naturopathic Medicine, and a Doctor of Education from the University of Pennsylvania. Throughout his career, he has been active in licensure efforts and other ways to advance naturopathic medicine. Over the years, numerous organizations have recognized his contributions, awarding him numerous awards, including the President's Award, the Physician of the Year Award, the Spirit of Rotary, and AANMC's Physician of the Year Award in 2007. In 2009, Dr. Mittman received a great honor when he was chosen as a Piper Fellow. His fellowship focused on gaining advanced skills in fundraising in order to continue the advancement of Southwest College. So once again, thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me turn it over to Dr. Mittman to begin our presentation.
Good afternoon, everyone. It is a pleasure for me to be here with you and talk about the future of healthcare, specifically as it relates to the rollout of the Affordable Care Act and some opportunities for the naturopathic profession. And so in the course of the next hour, we will go over the following. Number one, rather than just sort of tell you or list how naturopathic medicine can fit in, what we're going to do is make this a learning experience where part of what we will cover as it relates to naturopathic medicine is what is it about the current state of healthcare, the current needs of our public, and the opportunities in the Affordable Care Act that opens up new possibilities for naturopathic medicine. And so in order to do that, we're going to cover some of the basics of the Affordable Care Act. We'll contrast what we anticipate with what's going on now. We'll talk about a couple of components of it, such as an accountable care organization, or ACO. Talk a little bit about what are essential health benefits that people who have insurance, everyone is going to get, and how naturopathic medicine fits in with that. And then we'll open it up to questions and answers. So, for starters, I have to say, coming right back from the from our national convention in Colorado at the American Association of Naturopathic Physicians, a good portion of the convention at Keystone, Colorado, was spent talking about the Affordable Care Act and what's going on a national level, and what's going on in some of the states, including Arizona, that are, and what are we doing to position naturopathic physicians so that the public can maximize the benefit. And I have to say that I've never been more excited about the opportunities for this profession than today for two reasons. Number one, there is an alignment of public health needs with the solutions that naturopathic physicians can provide. And for many of you on the phone, that's probably not a surprise. The incidence of chronic disease, particularly related to lifestyle issues like diet, exercise, stress management, are continue to grow, and the expertise within the naturopathic profession continues to grow also. But that's been there for several years. What really excites me about the opportunity today is that this is the first time that the federal government has created an overarching structure that specifically includes naturopathic physicians and prevents discrimination and will increase access to naturopathic medicine. So what am I talking about? Well, rather than me sort of repeat what's in the bill, let me introduce you to Senator Tom Harkin of Iowa, who is one of the authors of the bill, and specifically on a very important section of the bill. So I'm going to switch over and see if we can get this video clip of Senator Harkin up.
Hi, I'm Senator Tom Harkin, and I welcome all of you to Washington for AANP's Federal Legislative Initiatives. I appreciate your taking the time out of your busy lives to come to D.C. to educate your members of Congress on the benefits of naturopathic medicine for both our physical health and our fiscal health. This spring, we're celebrating the second anniversary of the Affordable Care Act. I'm very proud of the fact that the law includes my amendment, the first federal-level non-discrimination clause to protect naturopathic physicians regarding participation in a health plan. Under that provision, no health plan or insurer may discriminate against any health provider, including NDs acting within the scope of that provider's license or certification under applicable state law. This will ensure that insurance companies cannot exclude NDs and other allied health professionals from practicing under the capacity of their training and licensure. As many of you know, I authored the landmark prevention title in the Affordable Care Act, which includes a whole array of provisions focused on healthful lifestyles, good nutrition, physical activity, and preventing chronic diseases. As naturopathic physicians know all too well, we don't have a healthcare system in America. We have a sick care system. If you get sick, you get care. The problem is that this is a kind of disease management approach. It waits until people develop serious illnesses and chronic conditions, and then spends literally trillions of dollars for surgery, pills, hospitalization, and disability. Meanwhile, ignoring Ben Franklin's "an ounce of prevention is worth a pound of cure." We spend peanuts on prevention. This is absurd, and it's unsustainable. And a major aim of the Affordable Care Act is to jumpstart America's transformation into a genuine wellness society. No question, NDs and integrative medicine can and must play a very big role in this transformation. We need an expanded role for NDs in order to reduce the shortage of primary care providers. Just as importantly, we need your sharp emphasis on wellness and prevention, and your pragmatism in taking full advantage of the very best available therapies, whether from conventional Western medicine or from alternative sources and traditions. And one more thing. It's high time to include NDs in the commission core of the U.S. Public Health Service, and also in federal health programs generally. So again, welcome to Washington. Have a great conference, and I hope to see many of you during your visits to Capitol Hill on Monday.
So Senator Harkin, as he mentioned, one of the authors of the Affordable Care Act, and specifically the section that he referenced there on non-discrimination for licensed practitioners, Section 2706, specifically referencing naturopathic physicians. And just so that you could see what's written into the law, and we're going to circle back on that in a little bit, that basically, like the Senator said, you can see as long as a practitioner is practicing within her or his scope of practice within a state or jurisdiction, that they cannot be discriminated against. That, for this profession, is a huge step forward to increasing the public's access to naturopathic medicine, and it opens up all kinds of possibilities and environments within which naturopathic physicians can work. So, some of these opportunities that we're going to talk about would include primary care. Right now, we have NDs who work in community health centers. We have NDs who are working on Indian reservations. We have NDs who are working in urgent care settings. But as you'll see when we talk about accountable care organizations, the opportunity for primary care providers, particularly as NDs, is going to grow exponentially. Naturopathic specialists will circle back on that, particularly as it relates to chronic disease. And then, since Senator Harkin also mentioned the emphasis on prevention and wellness, there's some opportunities that people are already taking advantage of in this area. I do want to mention, I mentioned the National Association, the American Association of Naturopathic Physicians, a little bit earlier. And really, our National Association, located in Washington, D.C., is working diligently to make sure that all the provisions, particularly 2706, is implemented, and they're working with Health and Human Services and working with the individual state representatives to see that as many people as possible will have access to naturopathic medicine. So now just a quick overview of what we're going to see as the Affordable Care Act unfurls. First of all, millions more people are going to be insured, particularly as states increase Medicaid enrollment. All ages are going to be required to have insurance. So that includes young people who often forego insurance, and that makes it possible for insurance companies to have a healthy mix of, financially healthy mix of people who are young and relatively healthy together with middle-aged and older people who tend to have more illnesses and more healthcare expenses. No discrimination for pre-existing illnesses. There will be support for small businesses. Large businesses, defined as over 50 full-time employees, are going to have to provide insurance. And then people can opt out, and businesses can opt out also, but you have to pay a fine for that. And then there are 4 levels of plans. I'm going to give us an opportunity now to take a quick look at a very informative and rather enjoyable video that explains from a consumer standpoint how all of this is going to work. And as you watch this, see if you can kind of discern what's going to happen on the provider side, on the insurer side, and from the business side, because a lot of that is what we're going to talk about after the video. You can find this video online. You'll see the credits, assuming that my computer functions. This is an update. This is an update from just a few weeks ago.
Well, it's finally happening after years of drama on Capitol Hill. A Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks, but didn't. The marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in. And big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all. But let's begin in the workplace. Many Americans are already covered by their employers, and for them, not a whole lot will change. There will be some new advantages, though, like caps on how much you have to pay out of pocket, and free preventative care. The bigger changes are coming for those who work for larger companies but aren't covered now. That's because the government is going to require companies with 50 or more employees to cover full-time workers or pay a penalty. So more workers may find themselves covered. Smaller employers won't face the same penalties for refusing to buy insurance, but they'll be encouraged to do so. The government will be setting up special marketplaces to make it easier for small employers to take the plunge. Some will be offered temporary tax breaks if they do, and unlike now, insurers can't inflate prices if some employees are sick. So many of us will be getting covered at work. A lot of us will be covered with help from the government, just like today. Not much will change for seniors on Medicare. The law has already started helping with prescription drugs and better preventative care, and that will continue. Medicaid, on the other hand, is expanding to cover more of us, especially poor adults, many of whom aren't eligible today. If your income is low, Medicaid will cover you, most likely in a private insurance plan. But there's a catch. The Supreme Court ruled that governors and legislatures of each state should decide whether or not to be part of expanding Medicaid. In states that get on board, the feds will cover almost all the cost. But for those who don't, you may be left with the same options you have today if you're poor. So you'll want to check out your state's decision if you think you might qualify for Medicaid. Even with employer coverage and the expansion of Medicaid, a lot of us will still be left out. For those not covered or who find their work coverage too expensive, a new way to buy insurance on our own will be popping up everywhere. They're called health insurance marketplaces, though they may have a fancier name than that in your state. The health insurance marketplace is like a virtual insurance mega mall. Here you'll find private insurers competing for your business, and you'll be able to pick out how much coverage you want and how much you want to pay for it. From cheaper, high-deductible bronze plans to more expensive platinum plans. Still, all plans will cover a comprehensive set of services like hospital and doctor visits, maternity care, mental health care, and drugs. Most everything any of us need, at least when it comes to medical care. As with Medicaid, not all governors are on board to set up these marketplaces, but the feds will open their own in those states, and so you probably won't notice much of a difference. One big advantage of buying insurance through these new marketplaces is that the federal government will provide most people with a tax credit to make insurance more affordable if you don't have any other options and your income is below a certain level. In fact, most people buying on their own will be eligible for a tax credit and won't have to pay the whole premium themselves. And the marketplaces will make sure that insurance companies operate fairly under strict rules. They'll have to offer everyone insurance even if they're sick, and they won't be able to charge more for pre-existing conditions. Unlike today, men and women will pay the same price. And prices for older people will come down, while young people will pay more. To keep costs down for young people, though, they'll be able to stay on their parents' plans until 26 and buy low-budget catastrophic plans until they're 30. Of course, all these changes still don't mean insurance will come cheap. Most people buying their own coverage will end up paying less with the new health insurance tax credits. But some people will have to pay more, even though many of them will be getting better and more secure insurance. So let's be realistic. Not everyone's going to run out and buy insurance. Some might say, hold on a minute. If I can't be turned down or charged more, why not just wait until I get sick or injured to buy insurance at all? Well, first, you can only get coverage during special enrollment periods. So if you snooze, you may lose. And second, thanks to something called the individual mandate, if you're not insured, you pay a fine, making this option seem not nearly so clever. Still, if you really can't afford to buy in and can't get insurance anywhere else, the government will waive the penalty. So don't panic. By now, you've probably noticed a lot more people will be getting a lot more coverage. Where will the money to pay for that come from? Taxes. Many of them targeted at the health industry itself, even tanning services. Yes, individuals will pay too, mostly the wealthiest Americans who will be paying more into Medicare. Also, hospitals and insurance companies participating in Medicare will get paid somewhat less. Not painless, but somebody's got to pay. So, as Americans prepare for 2014, how will you be covered? How would you like to be? Now's the time to figure it out and get on the path to setting yourself up for the best insurance at the best price. After all, who wouldn't want that?
Great. For more information on how to get that video, just send us an email and someone from our admissions department will get you a copy of these slides and particularly this URL. So take a moment and think about what you saw in that video and think about what's going to be different. What's going to be different moving forward? And some of the main differences are going to be attempts to what's called bend the cost curve, or in other words, keep lower costs or at least keep them constant or decrease the increases that we've been seeing, the double-digit increases we've been seeing. There's going to be a return to capitation. We can talk about that in a second. As Senator Harkin and the video mentioned, an emphasis on prevention and wellness, and we're going to be more outcomes-based than procedure-based. And then finally, there will be an emphasis on accountability, both among providers, insurers, and also individuals. So let's start with capitation. And I'm going to talk about each of these and particularly what it means from a naturopathic perspective. For those of you who've been around for a while, you may remember capitated healthcare back in the early 90s during the era of the HMOs, or health maintenance organizations. And basically what that means is an insurance company will have a specific amount of money for a specific amount, a specific number of people to take care of. And that's it. The same is true for providers. So if a group of practitioners or a hospital or a group of hospitals and other healthcare providers which is called an ACO, or Accountable Care Organization, is contracted with an insurance company to provide care for X number of people. They have to operate within that framework. There's a lid, in other words, on it. There's no more additional money that will come out of that. And therefore, it's important if we're going to operate where there's basically, it's like operating with a budget. You've got so many people to take care of, you've got so much money to take care of them, and so it's very important that the providers are prudent about how they order tests, how often they order tests, what kind of treatments are administered, and most importantly, finding ways to keep people well. And for both people who are healthy and want to stay well, and for people who are already sick, particularly with chronic diseases, naturopathic medicine has quite a bit to offer. From a wellness and prevention standpoint, there's an entire section in the Affordable Care Act on wellness, health promotion, and prevention. You know, right now, we spend less than 5% of the $2.5 trillion we spend each year in the United States on healthcare on prevention. So less than 5% goes to prevention. And a lot of that includes things like mammograms, prostate exams, colonoscopies, which is really early detection. In the new healthcare system, there will be reimbursement for wellness and health promotion activities. There will be opportunities for companies to incorporate wellness programs into their insurance plans. And finally, individuals are going to be encouraged, either with a carrot or a stick, to practice prevention. You know, currently, healthcare providers are reimbursed on procedures. So take, for example, a patient who has 2 doctor visits on a given day. Patient is 78 years old and has diabetes, high blood pressure, had a heart stent put in 3 years before, and they also have had several bouts of diverticulitis. They go to their primary care provider, and that person is reimbursed for a certain amount of time and complexity of the visit. That's in the morning. In the afternoon, the same person goes to the dermatologist because they have a suspicious mole on the back of their neck that they want to get checked out. And so the dermatologist removes the mole, sends it off for a biopsy, and then while they're there, they take off 8 other skin tags or little growths called actinic keratoses or seborrheic keratoses, things that are fairly common in older people. Who do you think gets paid more, the dermatologist or the primary care provider? Well, it turns out the dermatologist gets paid for not just the visit, but for every single removal and biopsy that gets done. They get reimbursed over and over again, so much, much more. And so here, it's really going to be not just about what you do, but about how healthy are you able to keep your patients. And again, here's an opportunity for naturopathic medicine to really shine. And finally, there's going to be an emphasis on accountability. So, you know, some of the people on this webinar may have already received some kind of rebate from their insurance company. So insurance companies are only are required to spend 80% of the fees collected on the health care and not for administrative costs. Practitioners are going to be held accountable because of what we talked about with capitation, And then individuals are going to be held accountable also. And so there are provisions for the first time. For example, if you're a smoker, you're going to pay more for your health insurance than you're not a smoker, if you're not a smoker. Here at Southwest College, for example, we are telling employees here, our faculty and our staff, that we're providing some wellness activities. If you participate in the wellness activities, you're going to pay less than if you choose not to participate. And then over the next few years, that accountability increases to the point where people are not only going to be incentivized to participate in wellness activities, but they're also going to be penalized if they don't, and if they continue to engage in health risky behaviors. So in the video they mentioned essential health benefits, and so take a look at this and think about how this relates to naturopathic medicine. So everybody, regardless of the level, the bronze, silver, gold, or platinum, is going to be covered for these services: emergency, hospitalization, etc. And then think about what a naturopathic physician is trained in and where licensed is able to provide. Pretty much all of it. And so just parenthetically, what's projected to happen is, like in the case in many areas in business, there's going to be a lot of consolidation. So the insurance companies are going to boil down to what they call BUCA, Blue Cross, United, Cigna, and Aetna. You're going to see a lot more interdisciplinary collaboration among practitioners. So again, here is an excellent opportunity for naturopathic physicians who, in addition to the acute care that we can provide, really have an emphasis and a love of working with patients to change their lifestyles, to improve their diet, exercise, stress management, etc. And then this consolidation of providers into what are called accountable care organizations. And here's the definition. And remember that if ACOs are going to be capitated, then it's really from a financial and a patient care standpoint in the organization's best interest to make sure that you've got the right team. And what we're seeing is more and more are beginning to incorporate naturopathic physicians so that we can drive down the rates of illness, improve people's health, and lower cost. And the scope of practice for naturopathic doctors is really broad enough in pretty much every jurisdiction where we're licensed to be able to effectively collaborate in a number of ways as primary care providers. And so picture someone working in a community health center, in an urgent care center, in an outpatient primary care center. You can have NDs working side by side with MDs and DOs, nurse practitioners, physician's assistants. That kind of all-in-one environment would be called a medical home. And this is just starting to roll out the credentialing of medical homes, but naturopathic practices are currently being credentialed as medical homes as well. Now, there are some NDs who really don't want what you would consider primary care or kind of a general practice, and we have the opportunity for naturopathic specialists such as the naturopathic oncologist or naturopathic pediatrician. And these are, again, opportunities, particularly as it relates to chronic disease, for naturopathic doctors to both contribute to the public's health and overall wellness, but also to find good career opportunities. And then finally, an emerging field is in corporate wellness, and naturopathic physicians are beginning to work with businesses and large groups of businesses to provide this kind of care on a bigger scale. Pioneered by Dr. Bernie Noe in Vermont, he was really one of the first people to take this on a much larger scale, where he worked with the Vermont Auto Dealers Association, not a particularly healthy group to start with, but he won the Governor's Gold Award 3 years running for the impact that his program had on individuals' health and also on the cost savings. Getting back to this non-discrimination clause, this is something that exists in statute, but it's going to get rolled out on a state-by-state basis. And so the question is, what is the naturopathic profession doing to make sure that the non-discrimination clause, Section 2706, is implemented in each state? I mentioned the role that the AANMC is playing, its lobbyists in Washington, the support that the National Association provides for states, and then on a state-by-state basis, I know that the individual state associations, like here in Arizona, other states like Oregon, Vermont, Washington, Colorado, are working with not just the legislators, but in particular with the insurance commissioner, so that naturopathic physicians are credentialed to provide essential health benefits. So, for example, in certain states, chiropractic has a carve-out, like you're allowed 12 or 20 visits to a chiropractor. Naturopathic doctors do not want that. We don't want to be accorded a special category, because what we want to be able to do is to provide the same services, treat the same patients as other practitioners who are eligible to provide essential health benefits. Some of the things that are also going on is research on the effectiveness of naturopathic medicine. And just to pick one, this was recently published in April, which was a very important study on the prevention of cardiovascular disease, published in the Canadian Medical Journal, which is Canada's Journal of the American Medical Association. And in the accompanying editorial, not only did they reference the positive findings in this study, but they acknowledged that there is an important role for naturopathic physicians to play in the prevention and treatment of cardiovascular disease. Here at SCNM, what are we doing? Well, we are working through our curriculum and the curriculum revision that we implemented starting 3 years ago to get our students kind of a jump start on their clinical skills. And so the curriculum is oriented to providing students a solid grounding in the principles of naturopathic medicine, but also to expose them to as many clinical settings as possible to practice as primary care providers or naturopathic specialists. We're working with the insurance commissioner, governor's office, and key legislators here in Arizona to make sure that the public has as much access to naturopathic medicine as possible. And we're also creating a program of community health and health promotion, working with not just individual patients, but with groups of patients to make significant changes in their health. Altogether, what's happening at the college, at this college, and at other schools as well, on the state level and on the national level, we are positioning naturopathic medicine, the future physicians who are in school, to really play an important role in improving the health, and not just giving people access to care, but giving people access to naturopathic care. And so with that, I look forward to any questions that you may have on this or a related topic. So thank you so much. It's really a pleasure, at least electronically, speaking with you, and I hope to have the opportunity to meet you in person. Questions?
Thanks so much, Dr. Mittman. That was very informative. So the first question is, do you think the Affordable Care Act will increase licensure in states where NDs are not currently licensed?
So the question of increasing licensure, I believe it will. We just had the Colorado was the most recent state to regulate naturopathic medicine. We have very active work going on in Massachusetts, Pennsylvania, Michigan, New York, and also in North Carolina. And I think as more and more opportunities to emphasize wellness and also the improvement for people with chronic diseases, there will be opportunities for NDs even in unlicensed states to participate, and that's one of the key components to building a licensure effort. Sort of like a catch-22. You need to have practitioners there, you need to build a base of patients, and you need to generate that groundswell of support. And so some of these opportunities will open up new states for licensure, and the really great news out of Colorado just this past spring really bodes well.
Great, thanks so much. Can you talk a little bit about any sort of guarantees regarding Obamacare and Arizona?
Obamacare in Arizona, well, you know, Arizona is one of the states that did not opt to create its own state exchange, and so that's, you know, something that will roll out. There will be a federal exchange. Arizona is going to increase Medicaid enrollment. You know, there's no guarantee that the passage of the Affordable Care Act is going to increase either access to or reimbursement in Arizona. It provides the opportunity to vastly increase that. What we have to do here in Arizona, as in other states, is work diligently with the insurance commissioner, number one, to make sure that NDs are listed to provide essential health benefits, and we're working on that over the next few months, number one. Number two, we have to work with the accountable care organizations to really position the naturopathic profession as a as one of the key pieces of this healthcare puzzle. And then we have to go out and market ourselves as a profession to the businesses who, you know, still continue to pay the majority of the health insurance premiums. And so, you know, the short answer is no, but the long answer is that, you know, that's part of some very important jobs here, including my own.
Thanks, Dr. Mittman. Can you provide any similar commentary on what you think will happen in California?
I know that California is, they have a meeting scheduled with their insurance commissioner either in August or in September. So pretty much each of the states are following the same playbook. We all met in Colorado. We had you know, key stakeholder meetings. We've shared all the resources that we have, the studies, the talking points, and you know, as one state, you know, succeeds in this area. So Vermont was the first to succeed. Then the insurance commissioner in Oregon agreed to include naturopathic physicians for essential health benefits. And so now the next steps are in California, and in September or no later than October here in Arizona, we hope to accomplish the same.
Thank you. Can you speak to what insurance companies currently pay for ND services in Arizona?
Right now, Cigna credentials naturopathic physicians in-network. Every other insurance company, with the exception of Blue Cross Blue Shield of Arizona, will cover naturopathic services as an out-of-network provider. And then there are individuals who who've been credentialed, mostly because their patients request it. The most important thing for patients to do is to write their insurance company and say, it's important to me that I am able to see my naturopathic physician. And that's what's happened with several doctors.
Thank you. So we have a couple questions regarding potential challenges that NDs might experience as part of the Affordable Care Act.
Okay.
Just if you foresee any.
Oh, do I foresee any? Well, number one, the non-discrimination language, in other words, 2706, specifies that you can't be discriminated against within the scope of practice in the state in which you are regulated or licensed. And so there are currently 18 states that license naturopathic physicians, and so that non-discrimination language does not apply to any state that does not license naturopathic physicians. That's probably, the biggest obstacle right there.
Okay, thank you. You talked a little bit about the curriculum revision that SCNM went under and how you think that is giving our students a jump on everything that's about to come forth with the Affordable Care Act. Can you expand on that?
Sure. When we revised the curriculum, which went live in 2010, so we're currently going into the 4th year of the curriculum revision, we did it probably for 3 reasons, and all of them, I believe, work well with this emphasis on the opportunities for primary care, naturopathic specialists, and health promotion and wellness. The first one that I mentioned is very early, as in the first week, experience in clinical skills. And so our first-year students are, not only are they learning the basic sciences, but they're learning how to do a physical exam, how to do a history, how to chart. So the kinds of skills that they're really going to be required to use, not just in clinical practice in general, but particularly in multidisciplinary settings, is something that they're introduced to very early. They also have an opportunity for field observation, which is actually started this week for our first-year students, where they are out in various practices, and not just naturopathic practices, but also with MDs and DOs. So again, introducing them to this collaborative, interdisciplinary type of practice is very much a part of the curriculum revision. The second is taking all of the biomedical sciences, so your anatomy, physiology, biochemistry, microbiology, genetics, embryology, et cetera, and combining them into a human biology block, which is taught by system rather than by discipline. So rather than, covering, let's say, the physiology of the heart in October, but then not getting to it in anatomy until November, or not covering it in biochemistry maybe even until January. All of that is covered within the same time frame, within, let's say, the same week. So getting people to think from a systems perspective is very important to succeeding in practice. And then second, we've really de-emphasized the lecture component and introduced team-based learning, problem-based learning to really get people to think. And so being able to think and increasing your communication skills through team-based learning, I think bodes really well for this kind of interdisciplinary practice that we foresee in the future.
Thanks, Dr. Mittman. Just a reminder, if you have questions about today's presentation, You can type those into the question box. We'll also take any questions you have about the medicine and modalities or admission to SCNM.
Can I add one thing? It's not specifically about the curriculum, but something that we're embarking on starting in September. Is that all right?
Absolutely.
Okay, good, thanks. Starting in September, we will begin construction on a new facility at the school. And so, some of it is pretty what you would expect at a college, more classrooms. We're going to have a much larger library, more study space. But it's also going to have some features that I think are really important specifically to a naturopathic curriculum. And that includes a fitness facility, cafe, so we have places to eat, but also a teaching kitchen. And I talked earlier about the importance of health promotion and wellness in the Affordable Care Act. And we've already started to offer community education classes in plant-based nutrition. We're going to roll out Mediterranean diet, gluten-free, diabetes nutrition. And so this new facility will have a lot of that. And then getting back to this concept of collaborative interdisciplinary care, we're going to be building the first naturopathic integrative pain center in the country, particularly at a school where we're going to bring together naturopathic physicians, acupuncture, physical therapy, chiropractic, and medical doctors who will work together to deal with a particularly important group of patients. Number one, because 80% of patients who go to the doctor today present with some kind of pain. But number two, because people in acute and particularly chronic pain have, basically they have limited options right now. And I don't know if anyone has been following, the New York Times did a series of articles on the pitfalls of opioid prescribing, OxyContin, and morphine derivatives. But the number of people taking narcotics in our country has skyrocketed over the past 15 years. And we can't think of there's no better profession with more therapies, tools, and perspectives to help people with pain than naturopathic medicine. I mean, just think about it. Acupuncture, physical medicine, injection therapies like prolotherapy, platelet-rich plasma, general nutrition so that people would be less inflamed overall. And so we're going to be introducing students when the building opens in September or October 2014. We're going to be introducing students to an approach that that is much more than the sum of its parts, and we're just really excited about it. So as president of a school, it's hard to not talk about something like a new facility, particularly when it's going to do so much for our school and for the profession. So thanks for letting me share that.
Absolutely, I'm glad you shared that. Can you talk a little bit about minor surgery and our scope in Arizona and how that's taught as part of the curriculum?
Well, minor surgery means that you can do office procedures that do not invade a body cavity. So body cavity means the abdomen, the chest, or the cranium. And so minor surgery could be stitching up cuts or lacerations. It could be removing cysts. It could be draining an abscess. It could also be removing skin lesions like a mole, basal cell, squamous cell carcinoma, sending them off for biopsy. Students are trained in the class, in the lab, and in the clinic. Like most medical students, you get a lecture, you have a lab where, for the most part, students are sewing up pig's feet. And then they have the opportunity in the clinic, they're required to do a certain number of office procedures under the supervision of a licensed practitioner.
Great, thank you. You also talked about the growth of specialties in the profession. Can you talk about the ones that you see being more popular?
Well, the one that really amazes me over the past 8 years, where it started, actually they held their first meeting in my office about 8 years ago, is the AANMC, or the Oncology Academy of Naturopathic Physicians. And the AANMC amazes me because back when I was in school in the early 80s, oncology or treatment of cancer, that was like the third rail. You know, that was really off limits for anything other than the most orthodox conventional care. And thanks to individuals like Dr. Dan Rubin, institutions like Cancer Treatment Centers of America, and the AANMC, this is the fastest growing specialty in the naturopathic profession. And if you think about patients with cancer, my God, there's so much that they can benefit from having an ND on the team. And that's why, for example, Cancer Treatment Centers has an ND practice, has NDs, residents and staff physicians working in all of their hospitals. So there's the AANMC, the PED-AMP, the Pediatrics Association of Naturopathic Physicians, is also growing. And if you think about, you know, the future of human species, you know, it really rests on the health of children today. That's a little bit newer than the AANMC, but growing very fast. In just this past year, they created the Primary Care Association for Naturopathic Physicians. And this is going to be particularly important as we roll out the Affordable Care Act and NDs become credentialed to practice in primary care settings. So those are just 3 of the specialty groups. There are others, the Homeopathic Association of Naturopathic Physicians, there's an obstetrics, and there's also for women's health as well.
Great, thanks, Dr. Mittman.
You're welcome.
Well, we are coming to the conclusion of our webinar, and Dr. Mittman, I'll ask if you can mute yourself so I can finish without the feedback.
Thanks a lot. It was really nice interacting with you guys.
Thanks again, everybody, for participating and for putting up with the slight feedback that we had as part of the question and answer session. Just to answer another question, yes, this presentation will be available on our website at the end of the week, so you'll be able to download the full recording and go back and watch it again. If you'd like specific slides, you can email me directly, and I would be happy to send that information over to you. Also had a question about when the start date is for our fall class, and that is at the end of September, and we are still accepting applications for the fall class. So just wanted to briefly share some of our admissions requirements with you. We do require all students to have completed their bachelor's degree, a 4-year bachelor's degree, as well as the prerequisite coursework that you can see on your screen. We do use the centralized application for our applications, and the link to that is there on your slide as well. We do offer a free transcript evaluation service, so if you're not sure if you've met all of the prerequisites, you can send us copies of your unofficial transcript, and we'll let you know if you're missing any classes and then guide you through the next steps of the application process. So if you have any questions either about the webinar or about admissions requirements, you can see my contact information on the screen, and I highly encourage you to reach out to me and let me know what your questions are. Thank you again for participating in today's webinar. Special thanks to Dr. Mittman for sharing such valuable information with all of us. Stay tuned for our next webinar, which will be in August. And again, if we can answer any questions about SCNM, the profession, or admissions here at the school, please don't hesitate to reach out to me. Thanks again for your participation, and have a great day. And this concludes our webinar.